Okay, if you're managing wet AMD, especially on a Medicare Advantage plan, you know the feeling. That little knot of stress in your stomach about a delayed injection. It's not just about your calendar, right? It's about your vision. So today, we're going to build a super simple, repeatable system that gets you off the phone and puts you back in the driver's seat. Let's dive in.
Does that sound familiar? Yeah, that endless game of phone tag between your doctor's office and your insurance plan, it's just exhausting. The goal here is to get you out of that anxiety loop and into a place of confidence, where you have a clear plan to stop delays before they can even start.
All right, so here is the absolute key to all of this. Most of these delays, they're not your plan saying no to your treatment. Nope. They're caused by really simple, totally fixable administrative mistakes. We're going to call this the missing puzzle piece problem. And once you see it, you can't unsee it, and you'll know exactly how to fix it.
And look, this difference is everything. A denial means a doctor at the plan has reviewed your case and said no. But an incomplete request? That's just an administrative pause. It's just like the slide says. It's like yelling at a printer that's out of paper. It doesn't hate you, it just needs the paper. This isn't a fight you have to win. It's just a box you have to check.
So let's think about it from the reviewer's side for a second. They have a checklist and they are just looking for a clean match. They're checking 3 things right off the bat: who, what, and where. Who's ordering it? What exactly is the drug and code? And where is it happening? If any one of these tiny details doesn't line up perfectly, boom, the whole thing gets kicked back into the needs more info pile, and the delay clock starts ticking all over again.
So this is our entire mission. Your job isn't to prove over and over that you need this medicine. Your job is to make the paperwork so simple, so clear, so unambiguous that the only possible button for them to click is approve. It's a totally achievable goal.
Okay, so how do we actually do that? We're going to create a tool. It's a simple one-page document that's designed to do one thing and one thing only. Get a fast yes by giving that reviewer everything they need all in a single glance.
We call it the PA Proof Pack, and I want you to think of this as the cover sheet for your entire request. Seriously, this is your secret weapon. It's what's going to cut through all the noise and stop those frustrating incomplete messages in their tracks.
So let's break it down. What's in this thing? It's just the facts, ma'am. Your name and ID, your diagnosis, the specific drug, the dose, and critically, the site of care. The whole point is that a reviewer can look at this and in less than 30 seconds know everything they need to know. There's just no room for error.
Now listen to this, because it shows you exactly why this next part is not optional. A patient said this: their request wasn't lost, it was just filed under the wrong number. The second they asked for the case ID, everything snapped into focus. Without that number, your request is a ghost. With it, you have a shared anchor that stops that whole "we can't find it" nonsense cold. Okay, so having the perfect paperwork, that's half the battle. The other half is making sure your clinic and your insurance plan are actually speaking the same language. And we do that with just a few very precise questions that create what we call the plan-clinic handshake. This first question is probably the most important one you can ask. Why? Because these injections are almost always a medical benefit, not a pharmacy benefit. One gets handled by one department, one by another. Asking this very simple question right at the start makes sure your paperwork doesn't get sent to the wrong building, which is, you guessed it, a massive cause of delays. Next up, you have to confirm the details. Don't just assume everyone's on the same page. You need to ask your clinic, can you tell me the exact drug, frequency, and site of care you're putting on the form? Because a tiny mismatch between your chart and that form is the definition of a missing puzzle piece that can stall your approval for weeks.
And here it is again, that shared anchor. You need to get that reference number. This little number proves the submission actually exists. It completely changes the conversation from, well, I guess you'll have to ask them to resubmit it, to, I'm looking at the submission from Tuesday, the case ID is 12345, can you please locate it in your system? It's a small detail, but it gives you all the power.
So, you've done everything right. You've got your proof pack, you've asked the right questions, but sometimes things still get stuck. It happens. Let's talk about how to handle those moments with calm, procedural language that actually works. So if you ever need to ask for an expedited or urgent review, the words you choose matter a lot. Don't go with emotional appeals like "I'm scared" or "I need this." Instead, you use the system's own language. You say, "A delay could risk my ability to regain maximum function." That specific phrase is designed to trigger their official process. It's the key that fits their lock. Now, submitting early isn't just about being tidy.
It's a strategic move. It's about building a time buffer for yourself. Because if a request gets kicked back as incomplete, the clock resets to 0. Having a buffer of more than 10 days means you can absorb one of those resets without your injection date being affected at all. It's your safety net.
All right, let's pull this all together. We're going to turn everything we've talked about into a super actionable checklist, a 15-minute plan that you can use literally today to take control of this whole process.
Here it is, the whole system in 5 easy steps. 1. Build your proof pack. 2. Submit it early to build that buffer. 3. Confirm it's in the right queue, medical, not pharmacy. 4. Get and track that case ID. And 5. If you have to, escalate cleanly using that magic phrase. See? It's a simple, manageable flow. In fact, here's what you can do the second this is over. Your next 15 minutes, call your plan just to confirm a PA is needed. While you have them, ask, is that a medical or pharmacy benefit? Then shoot a quick message to your clinic asking them to create that proof pack. And finally, ask them to send you the case ID as soon as it's submitted. That's it. That's how you start protecting your calendar right now. You know, if you only remember one thing from all of this, let it be this. The secret to all of this isn't some big dramatic fight. It's just getting this boring, unglamorous trio of details, drug, frequency, and site of care, perfectly right. This is an operations problem. It's a paperwork problem. It's not a personal failure, and it's one you absolutely have the power to solve.
So now, the ball is in your court. You have the tools, you have the checklist. The only question left is, what's your next move? What's the one thing you're going to do in the next 15 minutes to protect your calendar, protect your sanity, and make sure that next injection happens exactly when it's supposed to?